All right, everybody, welcome back. We're talking about text neck.
Yes, and some solutions for this, are pretty simple, but this is something that because teenagers are developing through skeletal maturity and they look down hours and hours a day, they're developing problems that we only saw in the elderly. And I've created some solutions here, and they're pretty simple, but here are a few. One of them, and this is the most important, and I've spent a long time developing this new therapy, and it's called PT-CPD therapy. And
that was in a Star Wars movie, right?
Yeah. And I've studied this quite extensively, and it's quite complicated. And PT-CPD stands for put the cell phone down. Yeah. Do something active. Throw a ball. Play a sport. Ride a bike. Catch a fish. Climb something. Put the cell phone down.
And you know what? They won't be able to say, if only I knew then what I know now, because you're telling them now.
I'm telling you. Yeah, I'm telling you. So,
but you know what? What do you do? I mean, you've got a young one. I've got a 28-year-old and a 21-year-old, and they are just connected to these phones. It's a part of their lives, and heaven forbid if you ask them, like we were out at dinner last night, and thank goodness I believe they can. No, they did have them at the table, but no one used theirs. Mm-hmm. But they were there.
Yeah.
It's hard to get these young people. You know what? I'm going to stop picking on young people because I'm 51 years old and I'm guilty of that too. Yeah. Deb can tell you.
Oh, I see. I can tell when your phone buzzes in your pocket.
Yeah. Uh-huh. I'm guilty of that too because we've made them such a part of our lives, and we think that if the boss calls, we have to have it. Mm-hmm. If something happens, we got to get that on the KTDY website. Yeah. I have to have this device on me all the time. Yeah. But so what you're suggesting to make a conscious effort to put it down?
Yeah. Now, some other really great tips, if you are using it, is when you use your handheld device, instead of keeping it in your lap, rest your elbows on the table in front of you and keep your phone at eye level.
Mm-hmm.
Okay.
So instead of looking down, another really good one is you can lay on your stomach propped up on your elbows on the floor on the bed whenever you text or look at your phone. This position is very, very good to prevent neck problems. It puts you in extension, not in flexion. So you can lay on your stomach, prop up on your elbows, and use your phone that way. Much, much better. And so, if you can encourage your teens or your young adults, instead of sitting on their bed, on their back, propped up with their neck on the pillow looking down, if they'll turn on their stomach, it'll make such a difference in strengthening those muscles in the upper part of their back. Now, I also want people to do this. If you're typing on a computer or you're using a handheld device or you're looking down, about every 30 minutes, I want you to stop and do this exercise. You're going to pretend that there's a spot in between your shoulder blades. And what I want you to do is attempt to touch the back of your head to that spot and attempt to touch your shoulder blades to that spot. So basically...
At the same time?
At the same time.
Okay.
So basically you're looking up as far as you can and retracting your shoulder blades as far as you can.
That feels good.
And you're going to repeat that 3 to 5 times. Yeah, and it's very, very good for you. And do that several times a day. Now, if this movement hurts you, you're in real trouble, and you need to come see me. If that hurts, you're in trouble.
Like, how bad is it supposed to hurt?
It shouldn't hurt.
Oh, I need to see you.
It should actually...
We've been telling you that for years.
Yeah.
Well,
okay. Yeah. And so do this exercise several times. Like if you're typing on the computer, about once an hour, stop and do that 3 or 4 times. Try to touch your head, back of your head, to in between, and you're not going to be able to, but try to get as far as you can, and then retract your shoulder blades to that spot as close as you can. Now, number 6 is don't slouch on the couch and watch television. I see this with a lot in teens as well. Their rear end is almost in the floor, their back is against the bottom cushion where your rear end goes, and their neck is against the back where your back goes. I'm not sure why they sit this way. But
you almost seem amused by this.
Wait till yours gets older. You'll understand.
I know. But either sit up on the couch or lay down on the couch. Don't try to do both simultaneously. And you see that. Like their rear is almost in the floor, their back is against the bottom part, and their neck is against the back part. So, either have them sit up or lay down. Don't try to do both at the same time. Now, another really good exercise that everyone on the planet listening to my voice should be doing. You're going to lie on the floor, on your stomach, propped up on your elbows. And this is real similar to the one I talked about earlier, but you're going to prop up on your elbows and you're going to put your forehead, you're going to bring your forehead down to touch the floor, and then you're going to bring your forehead up back as far as you can to that spot I was talking about.
I don't know, that sounds
Deb,
kind of like a push-up.
but-
You do it. You do it, Deb. You do it. You go first.
No, all you're doing, it's like a reverse sit-up, basically.
Wait, okay, say it again.
Okay, so you're going to lay on your stomach, propped up on your elbows.
Okay.
And you're just going to touch your forehead to the floor,
Okay.
and then you're going to bring your forehead as far back in extension as you can.
So you're talking about like bend your neck down?
Yep, bend your neck down to touch the floor
So
with
it's
your
really
forehead.
like a neck exercise.
It is a
Okay.
neck exercise.
Okay.
Your neck and upper back. So you're going to bring your forehead and chin up as far away from the floor as you can, kind of like a reverse sit-up.
Okay.
Okay, speaking of sit-ups, I have to interrupt you because I have to ask a question. Every time I try to do sit-ups, I end up with a sore neck. What am I doing wrong?
Are you pulling on your neck when you go up? Like,
Obviously, I'm doing something.
yeah. So if you'll take your hands instead of grasping behind your head, and you'll cross them in front of your chest
Okay.
and not pull on your neck, probably what it is.
Okay.
Yeah, you're probably using your hands to pull your neck up, to
Probably.
pull yourself
Because I
into
have
sit-up.
no core. Yeah.
Right. So, yeah,
Okay.
so
I think if you just look back behind you, you'll see Dave, your husband, trying to wring your neck. Push it down. Push it down.
Now, the last really quick point about this is that your postural muscles are non-volutionary muscles, meaning we should not have to think about them for them to work. So in other words, just like our heart beats and our diaphragm moves without us consciously thinking about for them to do that, our postural muscles are non-volutionary as well, meaning our bodies should do it without us thinking about sitting up. So
Okay, wait. So our what muscles should do what?
all right, our postural muscles should work without us having to think about it. So what I mean is this: if one of your kids is slumping over in a chair and you tell them sit up straight, and
They have to consciously.
that's not good.
They have to concentrate on doing it.
That should not happen. Your postural muscles should work without conscious thought. They should be non-voluntary muscles.
That makes sense. You see a baby sitting on the floor, they're always perfectly straight.
Right.
Their little back is
Yeah.
just, they're not hunched all over.
And then they get jobs. They grow up and get jobs and start stressing. And
They
And
get
they
a
get
phone.
tired.
they get tired.
So sometimes patients will come in and they go, yes, I really want to start thinking about sitting up straight and working on my posture. It's the other way around. Your posture should work without you thinking about it. And whenever you think about sitting up straight, you're using the wrong muscles. You're using the larger muscles of your back, like your lats and your rear deltoids and your traps. Those muscles are not postural muscles. The postural muscles are the little tiny muscles in between every one of our vertebrae in our spine, and those should work without conscious thought. So
I don't think I have any of those.
they're gone, right?
Well, I don't think I was born with them.
Well, have we untrained ourselves and
Well,
now trained ourselves to do it wrong?
Well, what I'm saying though is those muscles are weak. And if those muscles are weak, you consciously thinking to sit up straight is not going to fix that. Because when you forget, you slump again.
But how do you
absolutely.
exercise those muscles?
Well-
how do you make them come back?
Yes, anybody that has this, that they're slumping over and then they have to think about it to set up, they need to do something called a postural re-strengthening program, similar to what we do in our office with our patients. And there's a postural rehab program This specifically targets these non-volutionary postural muscles. A couple of the exercises that I talked about today are designed to do exactly that. So one of the best ones they can do is that one where they lay on their stomach, propped up on their elbows, where they're doing like a reverse sit-up. Those type of exercises are going to strengthen these postural muscles, these non-volutionary muscle groups. And so it's very important that the posture is maintained, because if not, it leads to much worse problems later on in life if not corrected. So if somebody you know is starting to slump forward, you should really pay attention to it, because it becomes a much larger problem down the road. When you look at someone from the side, standing up from the side, their ear and the tip of their shoulder and their hip bone should be in a pretty straight line. Even a small...
Stand up, Deb.
Even a small... She gave you the look. You got the look on that one.
Wait, the ear... Wait, say it again, please.
The ear The hole in the ear,
Uh-huh.
the shoulder, and the hip should be pretty much in a straight line. If the ear is a front of the shoulder, they're developing a postural problem. And so even a small head forward
My
posture
ears,
is a sign.
if we're coming from Baton Rouge, my ears get to Breaux Bridge before I do. I'm just saying.
Well, and then throw bifocals into that mix.
Yeah.
You got a whole other thing
Exactly.
going on.
And, that's the other thing with this we see, too. People that have to strain and get close to their monitor, so they're typing, but their head is stretched
Yes.
way forward looking
Yeah.
at their computer.
Yeah.
Not good.
You need to go see Dr. Lahey and change your eyeglasses
Absolutely.
prescription.
Yes, and get a bigger monitor for sure.
I have a question, and it's going to be really quite bizarre, but I'm going to ask
Well,
you.
that wouldn't surprise me at all.
I know, which is why I'm gonna stick to my reputation.
All right.
Okay. Bernadette Lee and I were having this conversation the other day. Larger folks, larger people especially with larger like guts. Okay. I watch them. I love to watch people, and people with larger like abdominal areas. Okay, abdominal areas. They tend to have awesome posture. Mm-hmm. And look, I've watched people just for that. I've been in the French Quarter just to watch larger people walk by to check out their posture, and their posture is perfect. Their eyes, their shoulders, their ears, their shoulders, and their hip. It's all right in line. Like if you took a 2x4 and measured it, it would go straight up and down. Why is that?
Well, probably because their postural muscles have had to work harder to hold up the extra weight.
Is that what it is?
Yeah, I would think that would be why.
Because
Maybe their spine is not straight or like it's supposed to be. Maybe it's curving.
Yeah,
hold
they
up.
have.
Yeah.
They always have to, work their posture extra hard to probably hold up the extra force that's applied.
Because I was thinking whatever it is they got going on, I'd love to have it, but without the big gut, But you can watch people. Y'all do this sometimes. Watch people, and larger people, watch them walk by, and most larger folks have incredible posture.
Yeah, probably because those postural muscles have to work that much harder, I would think.
Okay,
Yeah.
it makes sense. Mm-hmm. Because you would think that they would be hunched over too, all that.
Right.
But no, I mean it's. Okay, I'm done.
I will keep an eye on that and report back.
Report back. We're going to ask. There's going to be a test next Wednesday. Doggone it.
All right.
Bring your pen
All right.
and your pencil.
Well, I'm going to get back to my office before I get
Yes.
blown off the road with some of
Well,
that
that's
wind.
it. You're just going to leave us hanging. That's it.
That's it. I'm done.
All right.
Finished.
I love
Yep.
today's show. This
was a good show.
This was fun.
Yeah.
I like when you do
Fascinating.
these. Yeah.
Good,
Okay.
good.
Wellness Wednesday. That's Dr. Kevin right there, and
Yep.
you can. You guys at Bryant Wellness Institute's on Facebook.
Yep, the Bryant Wellness Institute's on Facebook. We got a lot of great info on there, and we add stuff to it all the time. So join us.
Hey, if folks want to contact you directly, because they like to talk to the guy that they hear on the radio, not his assistants, how can they do that?
Absolutely.
How?
Yes,
How?
Absolutely. 837-7174. If you ever need to talk to me, have any questions, I'm real accessible.
Or they can email.
Yeah, or email me.
What's your email address?
It's Dr. Kevin Linderman at gmail.com.
Spell the last name.
Dr. Kevin, Lenderman at gmail.com.
And ladies and gentlemen, that's
Everybody does L-I, but it's Lenderman.
because of his last name is the reason he's only called Dr. Kevin on KTDY.
You mean Linderman's not a good Cajun name everybody's going to remember?
No, I don't know how to say it. People still ask me all the time, "What's the last name?" I say, "I don't know."
Yeah.
Okay, all right.
I should have changed it to Lindrino or something like that. All right?
Lanyo. There you go. And then you could serve hot dogs.
Yeah.
Like Lanyo's on Ridge Road. Okay. Look here. Thank you, Doc.
All right. Thanks, guys.
All right, 8:34.